Hi. Hello. Hello. To this. All right. Hello. Hello. Good afternoon or good morning. Thank you to those who are watching this on the replay. Today we're going to be doing some practice questions review, and we're going to be going over the questions that I posted that we posted throughout the page this week. And just kind of helping you to better understand those questions and better understand how best to answer them. So if you're ready to think critically, then you want to watch this training all the way from the beginning to the very end. So hello on Instagram. Hi, I see you. Let me know where you're watching from Instagram and Facebook. Hello, hello, hello. Let's see. I see you. Hello. Hello. Hi, Bianca. Hello. Welcome. Thanks for joining today. Glad you're here. All right. Glad you're here. Let's see. Okay. Hello, hello, hello. Good afternoon from Brazil. Hello from Brazil. Welcome. Thank you for being here. Hi. How are you guys doing today? Happy Friday. Hope you're ready and excited for the weekend, right? So, hello. You're also from Brazil. Wow, what are the chances of that? Two people from Brazil. Oh my goodness. That's not usual. Hello, hello. Hi. Hey, 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 hey. Let me ask you a question and tell me right now in the comments. On a scale of 1 to 10, with 10 being, oh my gosh, I am so good at questions. Like I get 100% like all the time. To 1 being, oh man, questions are so hard for me. Like I be struggling like no other. So which one would you say from one on a scale of 1 to 10? How confident or how proficient you are with questions. Hello from Zimbabwe. Wow, we got international house on today here on Instagram. Hello from Zimbabwe. Hello. Thanks for being here. Hello. Let's see. Facebook, let me know. It's not. I'm not seeing any comments on Facebook right now. Hello. Hello. Yeah. So from a scale of 1 to 10, with 10 being I'm amazing, to 1 being I like, oh my gosh, I get 0. I struggle so much. I don't know what I'm doing. Hello from Nigeria. Welcome from Nigeria. Hello. Depends on the topic. Okay, that's true. Okay, but overall then, overall, what would you say? Okay. Okay, good. Awesome. Okay. So let's go right into it actually. And let's start doing some practice questions. Hello, I see you. Hello, hello, I see you. There you go. Let's go right into it today and let's start doing some practice questions. So if you're ready, go ahead and put ready. I see 4, 6 out of 10. Okay. Okay, good. Not too bad. So hopefully we'll get you to feel a little bit more comfortable, with doing the questions for the most part. So if you're ready for us to start going through the questions today, go ahead and put ready in the comments. All right, put ready in the comments. And we're going to get started. And then if you're watching this on the replay, you can also put ready in the comments too. So lets me know that you're watching on the replay. And then as well, if you are interested in receiving help to pass your NCLEX exam, make sure that you visit the link in the bio on Instagram, or you can click above or below this video to schedule a phone consultation or receive help to pass your exam. All right, so I see a couple of readies. Okay, good. We are ready to go. All right, so let's do the first question. And I'm going to see if it's possible to share my screen. Oh, okay. It's not an option. Okay, so I'll just say the question out loud and I'll post the question in the comments on, what do you call it, on Facebook. Okay, so I'll post the question on the comments on Facebook. I wish it gave me that option, but it's not. Okay, all right, here's the first question. This is the first question. The question says, which assignment should not be performed by the LPN? All right, the licensed practical nurse. Hi. Which assignment should not be performed by the licensed practical nurse? Is it going to be 1, discontinue an NG tube, 2, start a blood transfusion, 3, insert a Foley catheter, or 4, obtain a sputum sample. All right, let me say it one more time. Which assignment should not be performed by a licensed nurse, an LPN nurse? Is it going to be 1, discontinue an NG tube, 2, start a blood transfusion, 3, insert a Foley catheter, or 4, obtain a sputum specimen? All right, so I see 2, 2 blood, 2 question mark. Oh, let's do like this. This is good. Okay. 2, so some 2s. Okay, Millie 2s. Okay. Okay, good. Okay, so let's go over this question then, right? So here's what I would tell you. It's important that you understand the difference between the LPN and the RN, especially if you're taking the RN exam. You got to know what they can and cannot do. That's really important to pass the exam. And one thing I would tell you too is that, like, although in the clinical world, hey, Nurse Haskins, although in the clinical world it may vary, for the NCLEX, it's pretty like black and white, right? So the clinical world is more like a gray area, but on the test, it's black and white. So the first choices was to DC the NG tube, so that's just taking it out, right? That's fine. The LPN can do that. So LPNs can do task-oriented task, right? They can do things that are more task-oriented, things that don't require new assessment, and then things that don't require teaching or new teaching. They can reinforce teaching, but not new teaching. So the first one is okay. Number 2 says start a blood transfusion. So that's it right there. All right. So blood transfusions is RNs only. All right. Registered nurses only. That's never an LPN. So, and because of several reasons why, it requires a lot of assessment to monitor a patient ongoing when it comes to blood transfusions, right? I have to monitor them at the beginning. First, I have to assess them that they need the blood transfusion. I need an informed consent. That's RN right there as far as to witness it. And then also as well, when we do the transfusion, we have to monitor for signs of reaction. So if you're ever uncertain as far as what should be the LPN or the RN, think about, is this going to require assessment? Okay. And then 3 says insert a Foley catheter. That's fine. An LPN can do that. And 4 says obtain a sputum specimen. That's also okay. So these are all tasks that's appropriate for the LPN to do. So yes, the best answer is going to be 2, start a blood transfusion. All right, very good. Looks like everybody got that for the most part, was number 2. Okay, and if you want to, what you can do as we're moving along is go ahead and track to see how well you do with these questions. And then at the end, you can tell me, oh, I got, X amount right, I got this wrong or whatever, right? That way you can see how well you're doing. So that's the first one. All right, here's the next question. This next question may cause you to think a little bit more. The question says, you are the nurse. I mean, first, let me post it like this in the comments so it's easier. Okay. All right. So the question says, you are the nurse caring for an infant that was admitted from the delivery room. Which finding should you report? 1, absent femoral pulses. 2, acrocyanosis. 3, Harlequin sign. Or 4, acyanosis. I'm going to say it one more time. You are the nurse caring for an infant that was admitted from the delivery room. Which finding should you report? 1, absent femoral pulses. 2, acrocyanosis. 3, Harlequin sign. Or 4, acyanosis. All right, let me know if you want me to repeat the question one more time. But that's the second question. What do you think that one is? I noticed too when we posted that question, A lot of people did not answer it. So, because you weren't sure, I'm assuming what the answer was. So, what do you think? Just throw a wild guess. Just throw a guess. 1, 2, 3, or 4. And if you want to get the answers of this on Facebook, only on Facebook. So if you're watching this on YouTube, it doesn't work on YouTube. It only works on Facebook. If you type the word answer, then you will send you a message via Facebook Messenger, and we'll send you the link to access the answers. All right, so I see one. Say one more time. Okay, sure. Let me say it one more time. The question says, let me put this here. The question says, you are the nurse caring for an infant that was admitted from the delivery room. Which finding should you report? 1, absent femoral pulses. 2, acrocyanosis. 3, harlequin sign. 4, acyanosis. All right, 1, 3, 1, 3, 2, question mark, A, B, 2. This is one of those assessment like questions, right? 1, okay. And if you have like a rationale you want to share why you're choosing the answer, that's also good too. Being aware of the rationale helps you, that helps you to stay focused on like the reasoning behind your answers. Okay. So 1, okay. So 1, okay. So you ready for this one? So the answer for this one is going to be 1, the first one. Absent femoral pulses. So absent femoral pulses indicate coarctation of the aorta. Coarctation of the aorta. So what this does is this defect, it causes bounding pulses. Oh, let me put this for y'all in the here. It causes bounding pulses and elevated blood pressure in the upper body and low blood pressure in the lower body or the lower extremities. B, C, and D are incorrect because those are all normal findings in the newborn. Okay? So that one, the correct answer is like I said, A. Harlequin sign, I'm trying to remember what harlequin sign is again. I want to say, let me see. Oh, okay. Harlequin sign oh, wait a second. Okay, it's like, oh, I remember now. Okay, it's flushing of the face. Okay, flushing of the face. So pretty much the color is like red and then it comes back. So that's normal in infants or newborns, I should say. That's harlequin sign. So it's good to be aware of different types of terminology when it comes to the test. So that's pretty much what harlequin sign is. All right, good. Yay, some of you got it right. Congenital left side heart malformation. All right, good. Okay. All right, let's do the next one. Okay. And if you can share this, if you share this video or tag somebody that would benefit from this as well. All right, the next question says, okay, this one's going to make you think. All right. A 71-year-old male client is recovering from a stroke and exhibits signs of unilateral neglect. Which of the following supports this suspicion? All right, let me say it one more time, the question. Okay, so a 71-year-old, like this, a 71-year-old, oh, I didn't want to do like that. I'm sorry, oh, it's like this text stuff. Okay, a 71-year-old male client is recovering from stroke and exhibits signs of unilateral neglect. All right, so which of the following supports this suspicion? 1, the client is unable to distinguish between 2 tactile stimuli presented simultaneously. 2, the client is unable to carry out cognitive and motor activity at the same time. 3, the client is observed shaving only one side of his face. 4, the client is unable to complete range of vision of assessment without turning his head to the side. So what do you think it is? 1, 2, 3, or 4? One more time. A 71-year-old male client is recovering from a stroke and exhibits signs of unilateral neglect. Which of the following supports this suspicion? 1, the client is unable to distinguish between two tactile stimuli presented simultaneously. 2, the client is unable to carry out cognitive and motor activity at the same time. 3, the client is observed shaving only one side of his face. Or 4, the client is unable to complete range of vision assessment without turning his head side to side. Okay, 3, 4. So Facebook is putting all threes. Instagram is putting 4. And what I'm gonna do, let me see if I can actually draw this for y'all real fast. Yeah, that's a good idea. So you can see the visualization of this. Okay, 4. Okay, 3. Okay. Let's see if I can move this a little bit. So let's say you have, draw like this, a patient. Okay. All right. So when somebody has a stroke, depending on where the stroke occurs determines the type of damage that they have. And you can have, and usually this, like where the stroke is, the opposite side is usually affected. So you can have, you can have a stroke where it's from, for example, here and down, or their waist and down. And then you can also have it where the stroke affects one side of the body. So it will look like this. So what will happen is that, let's say the stroke hits on this side. Can y'all see that? Oh, here, let me put this like this for y'all. Okay. Right? So let's say the stroke hits on this side and the damage is on the other side. So this is all, so everything that's grayed out or that I'm marking right now is damage. Okay? So now what happens is that because it's damage here on one side, this is what you call unilateral. You can see it? Can you see it now, y'all, on Instagram? So this is what you call the unilateral neglect that it's referring to. So as a result, they can't see or perceive one side of their body. Let me put this here. Okay, so if you can see it now? Okay, great. So as a result, they can't perceive one side of their body. So because of that, unilateral neglect. So the best way that I would know that, this says the word stroke, that would confirm this type of stroke is if they look in the mirror and when they're shaving, they're only able to see one side. That's why they're only shaving one side of their face. So the best answer would be 3. You see that? That's essentially what it is right there. So the stroke, that, let's say the clot is on this side, if the opposite side is affected, this occurs. So neglect, unilateral neglect. So that word una is one, lateral is side, and neglect is not attending to. So that's why you're using the word unilateral neglect. So 3 would be the best answer. So 4 is saying, what does 4 say? 4 says the client is unable to complete range of vision of assessment without turning his head side to side. So here's the thing about 4. 4 is not consistent with unilateral neglect because it has to do more so with the peripheral vision. So there's something called macular degeneration, and that usually occurs from aging, not really from stroke. And so that means they have to turn their whole head to see, but it's not a reflection of unilateral neglect. That's a different type of problem. Unilateral neglect means that I can only see one side, and that's why I'm neglecting one of the sides. It's not about the fact that I have to turn to see at my peripheral vision. That has to do with peripheral vision, not with my awareness of one half of my body. That's why it's not foreign. Okay? Make sense? All right. Does this help kind of drawing the illustration? Does that help with the illustration? Okay. All right. Let's keep going. Okay. The next question says, does that help the person that asked? Does that make sense? Do you kind of understand? All right. The next question says, which of the following statements by a mother of an 8-month-old would concern the nurse? All right. So which of the following statements of a mother of an 8-month-old, like this, of an 8-month-old infant would concern the nurse? All right. So one is the baby. So my baby. Okay. So it says which of the following statements made by the mother of an 8-month-old infant would concern the nurse? My baby, and the choices are: 1, cries all day at the sitters; 2, is teething and therefore running a fever; 3, doesn't pay attention to loud noises; 4, throws both arms forward when held. All right. Oh, sorry about that, Instagram. One more time. Question says, which of the following statements made by a mother of an 8-month-old infant would concern the nurse? My baby cries, 1, cries all day at the sitters; 2, is teething and therefore running a fever; 3, doesn't pay much attention to loud noises; 4, throws both arms forward when held. So 3, 4, or 1, 3. Okay, 3. And then tell me why you're choosing that one. 3, 3, 3, 3. Okay, 3, 1. Okay. Okay, ready for the answer? You ready to see this answer? 3. Okay, so Facebook is putting 3, and Instagram got some 3s and some 1s. All right, so here's the answer. Okay, this is the answer for this one. The answer is actually 2. Is teething and is running a fever. You chose that one because it seems most concerning. That's the moral reflex and should be off by 4 to 6 months. Okay, so here's this was the answer is B. So here's the reason why. The process, oh my God, yeah. The process of teething is normal, or is a normal physiological development, and does not cause an elevation in body temperature. If an infant has a fever, there is an infectious process occurring in the body. So here's what I'll tell you. I know one thing that somebody else pointed out to me, one of my students, is with this question, is that when she had her baby, the doctor told her it was normal for her for the baby to have the fever and not to be worried about it. So that's reality, right? But when it comes to the NCLEX exam, that's totally different. The NCLEX never wants you to ignore fever. All right. So on the for the NCLEX, a fever in any situation is never um, a continue to monitor type of situation, right? So you have to. So for the most part, you should assume fever is associated with an infection for the test. So that's why two is the best answer. You didn't get the question? I'm sorry. All right. That's why two is the best answer. Oh my God. Yes. So the other ones, what were the other choices again? Okay, yeah. So the other ones, and the baby is how old? Let me see one more time. Oh yeah, 8 months old. Okay. So yeah, so the other ones, like between all of them, that one is the most concerning because it's the reason why it's more concerning is because it's an acute sign. All right. But then how do you explain the baby not being aware of loud noises? What I will say is that it doesn't mean that that's bad, right? Or sorry, it doesn't mean that that's not a something that you shouldn't respond to. But remember, the question is saying most concerning. So most concerning is saying that there can be more than one answer, but which one needs to be addressed immediately? And a fever, which can be an infection, for this sake of the task, is most concerning because it needs to be addressed immediately. Doesn't mean we don't need to address the noise part, but between the two, this is saying that um, the infection is more concerning because it's an acute issue. That's why. Yeah. Let's see. Why is three wrong? Wait, three was. Let's scroll up. Yeah. Oh yeah. That's what we just said. Yeah, that's what we just said. Yeah. So remember, you have to when you ever see questions that says statements, right? When you see questions that have statements on it, you understand now? Okay, great. And it says you have to be aware of the fact that there could be one choice that is more, but which one is more urgent than the others. So that's how you differentiate the choices. Awesome. Okay. Let's keep going. All right. So the next question, let's pick one that's a little bit more difficult. Okay, here's a good question. A 12-year-old client has a PICC line inserted for home IV therapy. To confirm proper PICC line placement, which of the following should the nurse anticipate doing immediately following insertion? 1. Aspirating for venous blood return. 2. Auscultating the site for a bruit. 3. Taking the child for a chest x-ray. Or 4. Measuring the Look, I didn't even finish that. You already put the answer. Measuring the catheter's external length. All right. So let me say it one more time. Put this here. So you have a 12-year-old child. Okay. So you got a 12-year-old child has a PICC line, and it's asking you to confirm proper PICC line placement. Which of the following should the nurse anticipate doing immediately following insertion? 1. Aspirating for venous blood return. 2. Auscultating the site for a bruit. And then 3. Taking the child for a chest x-ray. Or 4. Measuring the catheter's external length. All right, let's see. I see x-ray. Three. Okay. 1, 1. All right, so I see 1, 3. Okay, because you can do all the other interventions after you check the x-ray. Okay. All right, so let me draw for y'all. Let me help you to see what happens when we put a PICC line in. Okay, so a PICC line can only be inserted by a certified. You feel like you're wrong? A PICC line can only be inserted by a certified PICC line nurse, or a doctor, right? So you have to get certification to put a PICC line in, because it literally travels to the heart. So let's draw a patient again, and let's do it like this. Look how I made the arm so long and thick. Okay, let's do it like this. Okay. See, I got bomb drawing, y'all. Don't you love my expertise drawing? Okay, so pretty much can y'all see the picture? Okay, yeah. So when we put a PICC line in, there are veins that run through the arm. All right? There are veins that run everywhere, but there's veins that's in the arm, right? So the nurse will get a like a ultrasound to do this procedure at the same time. So what they're doing, they're taking this long catheter. It's like a really, really long catheter, and they're inserting so let's say the catheter starts here, for example. Actually, I take that back. It's going to start higher. It usually starts way higher than that. So let's say it starts right here. So they're taking, and they're going to measure the catheter length before they do the procedure. So as the nurse, you're supposed to, as the nurse that's taking care of the patient, you're supposed to know what number it stops at. So the catheter, and then this is the heart. So that's my beautiful heart, y'all. Thank you. So this is the catheter. So this is the catheter. All right, those lines I put right there, those lines represent the numbers. So anyway, so the catheter, they literally are stringing the catheter all the way to the heart. That's essentially what they're doing. Okay, so and let me put this here, catheter. All right, so and then they put like a gauze over the insertion site. You see that? So now what happens is, okay, now they put, so this is like a clear gauze. And then we change the gauze every, 7 days, right? So essentially what the PICC line nurse does, and then what she's usually doing is that she, like I said, has an ultrasound that's guiding her as she's putting it into the heart. So the PICC line, right? And then these little numbers, whatever, like I said, we have to know what number it stops at. And that's how we know if the PICC line moved from where it is. So usually they suture the site as well to make sure it doesn't move. So a lot of times they suture the site as well. So when we do this procedure, what would be the best way to confirm it's really in the heart? Like, right? The best way for us to make sure that this catheter doesn't actually hit the heart is to do a chest x-ray, right? Bam. A chest x-ray would be the best visualization to confirm that this catheter that she just put in really traveled and made it to the appropriate place in the heart. That's why the chest x-ray is the golden standard. So yeah, 3 is the best answer. You see that? That's the reason why it's 3. Yeah, sterile procedure as well. Okay, that's sterile procedure as well. Does that make sense? Yay! Does that make sense? Showing you the picture. The other options, like the blood return, sure, but that's not like, I want to see it though, right? The Brewy is not for this. Brewy is for dialysis. And then measuring the length, that doesn't tell me anything. Those are these, in fact, one and 4 are all things that you do after you put it in, not to confirm. All right, so like if the patient had the x-ray already and it was day 2, I can, withdraw blood, right? But after I've already done the x-ray. All right, awesome. Okay, let's do one more question. Let's do one more question. All right, here's a good one. Let's do a sickle cell question. Let's do a sickle cell question. So the question says, post this here. You guys find this helpful? If you are, you know what to do. Like this video. Well, actually, you're on Instagram, so but share the video if you can. All right, if you can share with somebody, like send it to your DM or something. Share it to somebody that would benefit from this, or share it on Facebook, Instagram, wherever you're tuning in. All right, so this is the last question we'll do. Number 1. Oh, sorry. This question says you are performing discharge teaching for a 10-year-old client who has been diagnosed with sickle cell anemia. Thank you for the hearts. There we go. Yeah. Oh, yes. I forgot you can send hearts on Facebook. Yeah, they've been diagnosed with sickle cell anemia. Which of the following interventions is important to stress to the child and the family? 1. Increase fluid intake. 2. Increase fat intake. 3. Closely monitor bowel movements. 4. Serve leafy green vegetables daily. One more time. You are performing discharge teaching for a 10-year-old client who has been diagnosed with sickle cell anemia. Which of the following interventions is important to stress to the child and the family? 1. Increase fluid intake. 2. Increase fat intake. 3. Closely monitor bowel movements. 4. Serve leafy green vegetables daily. All right, fluids. Okay, water. Fluids and then pain meds. 3. Closely monitor the bowel movements. 1. Okay. All right, you ready for the answer? All right, 4. Okay. Okay. All right. So let me kind of actually illustrate to y'all what happens in the body when somebody has sickle cell anemia, right? Like what that actually looks like in the body. Okay, so let me draw this here. So when somebody has sickle cell, what does it look like when they have normal red blood cells? Normal red blood cells, normal RBC, right? So what do? They transport O2, fluids, and nutrients. All right. That's what a normal red blood cell, oopsie, okay, that's what a normal red blood cell does. But when you have a red blood cell that sickles in shape, okay, all those things that it would normally do are deficient, right? It can't do it as effectively. That's the reason why they need oxygen when they have a sickle cell crisis. That's the reason why their blood volume is low and they need blood transfusions often when they have a sickle cell crisis. That's also the reason why they have a lot of pain because the joints, the muscles, the organs are not getting enough oxygen and yeah, mainly the oxygen. So that contributes to the pain. The biggest thing that's the most important for your sickle cell patients, based on the choices it gave you, especially with diet, is fluids. Okay? They need more fluids to compensate the fact that the red blood cells are not able to appropriately move blood, move fluids throughout the body like it's supposed to. So they need more fluids than usual. So fluid intake is the priority when it comes to your patients who have been diagnosed with sickle cell. So with this one, the best answer, what were the choices? I already forgot what they were. Okay, yeah. So the best answer is you're gonna give them you need to increase the fluid intake. All right, is to increase the fluid intake. Yeah, so fluid intake is the best answer. I think the other choices said like let's see, one fluids, two fat. That's not important. Um, oopsie. Three closely monitored bowel movements. No, bowel movements is not relative. Four serve leafy green vegetables. No, you know, that's if I was thinking about the vitamin K levels, right? That's the reason why I would give the vegetables, right? Or if they're like high bleeding risk, which they're not. So one is the best answer. Okay. Oh, if you're having, yeah, I think the network is only on your end because I'm not seeing my phone. My battery was dying though on my phone, so that's probably the reason why. All right. Okay. So let's do. Wait, did I want to do one more? Okay. Let's do this last one. Let's do this last one. Yay! All right. If my phone dies on Instagram, I apologize. I think we got a time for just a little bit more, so I'm gonna do this as fast as possible. All right. So, if so, what I want to encourage you. Okay, let me say this right now in case I forget. Then, if you find this helpful, I would encourage you to go to the link in the bio and schedule a phone consultation with myself if you need help to pass your NCLEX exam. If you're struggling to, really understand this material as far as like grasping how to answer questions, how to break down the material, that type of stuff, you would benefit from getting more help. We have our School of the NCLEX Mastermind program. We meet twice per week, and this is what we do. We do us amongst also teachings and etc. that you get access to. I go over visual trainings like this in the class, but it's via Zoom instead. So via Zoom, you can ask me, questions that you have, and then we do practice questions, and you get access to our video teachings, quizzes, exams, questions, a study plan, accountability. We have a private community, so it's a lot of it's an amazing experience if you're really struggling to pass your exam. So if you're on watch this on Instagram, click the link in the bio to schedule a free consultation. Or if you're on Facebook and YouTube, click above or below this video to schedule the call. All right, here's the last question that we're going to do. So this question here says, oh, this is a good one. Okay. In fact, you know what? Let's do this one. So this question says, what is the minimal apical pulse the nurse should obtain prior to administering digoxin to a hospitalized 5-year-old? A, 60, B 70, C 100, or D 120? I'm going to say it one more time. What is the minimal apical pulse the nurse should obtain prior to administering digoxin or lanoxin to a hospitalized 5-year-old? A 60, B 70, C 100, or D 120? You know what? While you guys are putting your answers, let me go grab my charger. Yeah, let me do that. Give me 1 minute to grab my charger. Oh, yes. Oh, I have a long charger. Oh, yay. Okay. Yay, we're charging now. I think I might have to move this over here. Okay. Oh, I love long chargers. Okay. Ooh. Is that gonna move? Ah, just kidding. Okay, hold on. Give me 1 second. Let me move the charger while y'all put in your answers. Yay, good. Now we're not gonna lose the video. Okay, so I saw, let's see, we got one BB on Facebook, and then on Instagram, 60A. Oh, okay, 75 to 115. Adults, 60. Okay. Okay, good. BB, okay. You guys ready for the answer? Let's see, 100. Well, I'm so glad I got the charger now. Okay, so here's the answer. Let me break this down. So like this question is said to you, which of the following is the minimal apical pulse the nurse should obtain prior to administering digoxin to a hospitalized 5-year-old? A 60, B 70, C 100, or D 120? So the key words in this question is minimal, and then also apical pulse and digoxin. Oh, and the 5-year-old. Those are the keywords. So digoxin is a medication where you have to check the pulse before you give it. The normal minimum for adults is 60 beats per minute. So if it's less than 60, you can't give it for adults though. This question is said a 5-year-old. It's different though for children. The blood pressure and the heart rate for children or for babies tends to be more elevated. The minimum pulse for 5-year-old is 70. B. So the correct answer is going to be B. 70 beats per minute. 70 beats per minute. Okay? You forgot adults? Forgot it was a child? Yeah. So that's why you have to review all of the key words in the question, right? Because if you just look at the first part and not the last part, then then it's easy to not choose that part, because if you miss the fact that they're 5 at the very end. Does that make sense? Is that clear? Awesome. Okay, good. Good. All right. You guys want to stop here? Yeah, let's go stop here. Okay, so I hope you guys found this helpful. Hope you found this helpful as far as going through the questions. So that one was definitely B, all right? 70 beats per minute. If you want to get access to all the questions that I went over on Instagram, just go ahead and click the link in the bio and click the one that says blog. And then you'll see the latest blog is called Physiological Integrity Questions. And that's all the questions I just went over and more. So if you want to get that, go ahead and you can go ahead and get all the questions there. If you're watching this on Facebook, then just type the word answer in the comments, and check your Facebook Messenger, and I'll send you the answers or the link that way. Okay, you can check it that way. If you're watching this on YouTube, click below the video and you'll get the answers below the video. All right. Once again, if you need help to pass your exam, you're struggling to pass your boards, you need help, click above this video or go to the link in the bio to schedule a free phone consultation. This is what we do. We have our School of the NCLEX program, our mastermind program. We meet twice per week in the classes. That's where you're going to get that personal accountability and coaching that you are looking for. If you want to be, you need more accountability as far as no, just type just type one word. All right, yeah, I'm sorry, maybe I should have made that more clear. Just type one word, answer, like that. That's it. Don't put type and then answer. Yeah, just type the word answer only. Okay, yeah. So even anyways, you need accountability. Like I said, it's a great opportunity. It's a program. It's a very intense program, and that's why I call it the School of the NCLEX, because it's designed to help repeat test takers that are struggling to pass their exam, or individuals that have graduated at least 5 to 10 years ago or more, or sooner, and that really want that hand holding. So if you're more interested, schedule a free phone consultation. The way it works, you click on that link, and then you get access to a free training. Watch that free training, and below the video, you can apply to schedule the call. The call is not guaranteed, but you have to actually apply though. All right. So that's it, y'all. Thank you so much for watching. I hope you have a wonderful rest of the day. If you have any questions, inbox me, email me, message me, and I'll be more than happy to help you. Have a wonderful day. Love you guys much, and I'll talk with you soon.